This video goes over how to get someone up from a chair as a caregiver up to a walker, and then with the walker, get them into a wheelchair. This video will show you how to get someone to stand up onto a walker and transition them into a wheelchair. So introduce yourself to the client or the patient and explain what you're going to be doing. It is possible that they can get up and you're just going to help them balance themselves. But at the same time, what you want to do first, go to the wheelchair, lock both brakes in. So both front brakes so the tires can't move. In this case, bend your knees and apply the gait belt. So it goes through the front, and make sure it's a little bit snug so that you can get 4 fingers in the front so that when you pull on it, it's a little bit snug but not too tight, whereas it suffocates them. And then you can tuck the strap in so the client's legs don't get caught on it or you. And when you help them get up, you want to bend your knees and use your thighs and your legs, not your lower back. So make sure they're wearing their shoes or their clothes that they want to be wearing. Put the walker in front of them. So in some cases, the client can grab on to the walker and you can help them assist. But in this case, we're going to look at a scenario where you pretty much have to help them. And in this case, they can put their hands up in the front and you're just there to check their stability by holding the belt. And what you can do then is they walk with the walker and you're there to add support so they don't tip over, lose their balance. Just make sure you're there to add some support. Have them walk forward towards the wheelchair and then they can back up towards the wheelchair. So this is important to make sure the wheels are locked so that the wheelchair doesn't scooch away. So in this case, the wheelchair is against the wall. So just in case it wouldn't move back. But there you go. So the client sat down, the gait belt's still on them. Again, if you have back problems, hip problems, or knee problems, you can ask for help, or you can use a Hoyer lift to lift them up out of bed into the wheelchair. If this video helped, check the show notes. We can help with caregivers, internal medicine, visiting podiatrists at home or your facility. If you need a job, apply down. We're always looking for great caregivers to help out as well. Thank you.